This is ASA TV. I'm Sarah Panko, and here with me now is Dr. Kenneth Elmassian. Thanks for being here with us. We appreciate it. So, Dr. Elmassian, can you tell us how has ASA's membership grown over the past year, and how has this growth been achieved?
Well, we're a very fortunate organization in that we have good member engagement, and we've got over 54,000 members now. And the growth has been achieved over the past year. We've almost hit a 3% number, which is excellent in 2018, but we're not done. The good news is that in the anesthesiology assistant area, 40% growth in there, and 33% growth in executives as well as administrators. So we've been on an uphill climb, and we're moving in the right direction, but a lot of work ahead of us. We've been very, very diligent about working with our members and in recruiting members and also the retention of members.
So, Dr. Elmassian, what are some high-quality educational resources being provided to help spur membership growth?
Well, thanks for asking. You know, we are really on the cutting edge of education and anesthesiology, and the ASA has been a great provider of resources. We provide resources for the entire care team, which is something that we feel is very important for the future education of those who are providing care to our patients. Some very novel digital technology has been utilized, the SimStat program, where we have simulation modules for appendectomy, for post-anesthesia care units, and in fact this fall we have one coming for labor and delivery, but there's actually a total of four, one more to be added, the labor and delivery, and they actually satisfy the MOCA Part 2 and 4 requirements for education. So it's very, very useful for our members. We also have developed an ACE, an anesthesiology assistant module as well, specific for that portion of the anesthesia care team.
So, Dr. Elmassian, how is the society meeting the needs of its early career members, such as young physicians, residents, and medical students?
Well, another great question, because our medical students, our young physicians and residents and fellows, they are clamoring for guidance, and we are there to provide it for them. We have a number of programs in place right now, especially they're very concerned about their careers, and we have our Anesthesia Career Center. We're very, very sensitive to the needs of our younger members. We're looking for them to expand and to grow our organization, so it would make sense to make certainly that we satisfy their needs. Some other things that we have in place as well is the cost of medical school and residency, even the cost during residency, are very, very expensive. And with the student debt that they have, we've developed a partnership with SoFi to have discounted rates, and that's been very popular actually amongst the residents. And so we're hoping that will also encourage them to see value in belonging to the American Society of Anesthesiologists. Another thing we're doing as far as the research area goes is we've developed a journey map where the timeline of their 3-year program and looking at their gaps and some of the things that we can do to support those gaps in their education and in their journey along their way as professionals. Some things that are really popular are the legislative conference. We have a tremendous participation by young physicians who come to that. I can speak firsthand that it's a life-changing experience for many of them to come to Washington, D.C. And then as research grants, we're working with in the global humanitarian outreach programs, research grants in the international level, and also research grants through the Foundation for Anesthesia Education and Research as well.
So we hear ASA is also enhancing membership value by expanding its group practice solutions. Can you tell us more about that?
I can, absolutely. It's an area that we're very, very focused on because we know there's a need out there for our smaller group practices in particular. So we've developed an alliance with the ASA called the ASA Group Alliance, actually, program. And what that does is it provides IT functionality, and it provides human resources, and other resources for them to those groups to come to the ASA for. So it has a practicality to it on the business side that's very important. We've also bundled, as I mentioned before about the anesthesia care team, we've bundled our some educational packages as well for these groups. And we've looked at our quality and AQI, our Anesthesia Quality Institute, and we've provided those services as well, a concierge service and some other basic services that you can choose from one column or another. And it's been very, very well received.
So, Dr. Elmassian, how is ASA working with state component societies to increase value and engagement at the local level?
Well, Sarah, I'll tell you, the state components are the backbone of our organization. The ASA is one of these organizations that all boats rise to the top, and we work very, very hard with our state component side, particularly in the area of legislative support. We're very vigilant about some of the legislative challenges going on around the country. We provide joint partnerships and CME meetings as well. And then we have a new program where we have recognition of best practices for each state component society, which has been received very well, and it's something that we're going to continue to perpetuate in the future. Some of the other areas is expanding some of the research and services and support services as well. And we think we're on the right path in getting our component societies to work with us and for us to work with them.
And lastly, Dr. Elmassian, how has ASA expanded its efforts to create a greater value in the international anesthesia community?
You know, there's a tremendous demand all over the world when we're looking at patient safety, and we're very instrumental in working with our partners across the oceans in the area of perioperative safety and quality. We work very hard with the European Society of Anesthesiologists in particular on SimStat, which is a simulation model, and our cross-Atlantic webinars have been received very favorably as well. There's a work group in place right now looking at perioperative fasting, which means the intake of fluid and food before your surgery, and particularly in children and infants. We have faculty meetings with international groups with Brazil and Korea, Europe, Japan, Colombia, Australia, and China as well. So, you know, we really have quite an international outreach and footprint that we continue to expand with our partners overseas.
Well, thank you so much for joining us here, Dr. Elmassian. We appreciate your time, and thank you for joining us.